Mycobacterium tuberculosis, also known as Koch'S bacillus, is a species of pathogenic bacteria in the family. Mycobacterium tuberculosis, also known as Koch'S bacillus, is a species of pathogenic bacteria that belongs to the family Mycobacteriaceae. This bacterium is infamous for being the causative agent of tuberculosis, a highly infectious disease that primarily affects the lungs but can also target other parts of the body. Tuberculosis has been a major health concern for centuries, with historical records indicating its presence dating back thousands of years. The discovery of M. tuberculosis and its association with tuberculosis can be attributed to German physician and microbiologist Robert Koch, who isolated the bacterium in 1882. Koch's groundbreaking work earned him the Nobel Prize in Physiology or Medicine in 1905. M. tuberculosis has several unique characteristics that make it a formidable pathogen. It is an obligate aerobe, meaning it requires oxygen to survive and replicate. The bacterium has a slow growth rate, with a generation time of around 15 to 20 hours, which contributes to the chronic nature of tuberculosis infection. Additionally, M. tuberculosis possesses a waxy cell wall composed of mycolic acids, which provides protection against the immune system and allows the bacterium to persist in the body. Tuberculosis typically spreads through respiratory droplets when an infected individual coughs, sneezes, or talks. The bacteria can survive in tiny aerosolized droplets for several hours, making person-to-person transmission highly efficient, especially in crowded or poorly ventilated areas. Factors such as malnutrition, overcrowding, and weak immune systems increase the risk of contracting tuberculosis. Upon inhalation, M. tuberculosis enters the lungs and is engulfed by macrophages, specialized cells of the immune system responsible for clearing pathogens. However, the bacterium can evade destruction and multiply within these macrophages. Over time, the infected immune cells can form granulomas, small nodules that ward off the bacteria but fail to eliminate them completely. This latent infection can persist for years without causing symptoms, but it can reactivate and develop into active tuberculosis disease if the immune system becomes compromised. Tuberculosis can have a wide range of symptoms depending on the organs affected. Common symptoms include persistent cough, weight loss, fever, night sweats, and fatigue. In severe cases, the infection can lead to lung damage, hemorrhage, and even death if left untreated. Diagnosis of tuberculosis involves various tests such as sputum analysis, chest X-rays, and tuberculin skin tests. Treatment usually entails a combination of antibiotics taken for a specified duration, typically 6 to 9 months. It is important to complete the entire course of medication to ensure the eradication of the bacteria and prevent the development of drug-resistant strains. Prevention and control strategies for tuberculosis include vaccination, known as the Bacillus calmette-guerin (BCG) vaccine, which provides partial protection against severe forms of the disease. Additionally, early detection, prompt treatment, and proper infection control measures such as providing adequate ventilation in indoor spaces, wearing respiratory masks, and practicing good hygiene are crucial in preventing the spread of tuberculosis. Despite the availability of effective treatment and preventive measures, tuberculosis remains a global health challenge. According to the World Health Organization, tuberculosis is one of the top 10 causes of death worldwide and the leading cause by a single infectious agent, surpassing HIV/AIDS. Addressing the burden of tuberculosis requires sustained efforts in healthcare infrastructure, research, and education to combat this persistent and deadly infection. Mycobacterium tuberculosis, also known as Koch'S bacillus, is a species of pathogenic bacteria in the family. Thanks for watching.